Hello, welcome to my channel. My name is Nurse Pauline. I will be uploading my videos on Tuesdays and Thursdays, Eastern Standard Time. The goal of my video is to assist nursing students to be successful in their Fundamentals of Nursing exam and in their Nclex. Today, we'll be talking about leaders. The focus for leaders are collaboration, becoming a great role model, creativity, and creating a sense of community through mentoring, clear communication, and conflict management. In leadership, skills we need are critical thinking, integrity, communication skills, professional socialization, respect, mentorship, emotional intelligence to work closely with trainees, dedication to excellence. In leadership, we need effective team leadership, improved satisfaction among team members and patients, and improves productivity. Nurse leadership system are democratic style, enhances the participation in decision-making procedures of an organization. Democratic leader, the final decision, she collects information, feedbacks, and ideas from her staff before finalizing everything. In this leadership, all feels valued and attempt to do their best. The next leadership we have is a transformational leader who is based to encourage workers to do their best and motivate them to be positive rather than negative. The autocratic leader, who is the authoritarian leader, the manager supervises her staff. Their input is not considered while making final decisions. Transformational leaders specializes in working to change the system, solving challenges by finding experiences that show old patterns do not work, wanting to know what has to change. The laissez-faire leadership only minimizes directions provided. This kind of leadership allows the staff to handle tasks on their own. In the laissez-faire leadership, we find this most in new leaders. In this leadership, we find these are inexperienced leaders, referred to as hand-off approach, to rarely provide direction or feedback to their team, but rather allows the team to function as they prefer without strong supervision. A charismatic leader is based on personal beliefs and characteristics of beliefs. Accountability is acceptance of responsibility for one's choices, decisions, actions. The nurse is always responsible for her actions when providing care to her patients. Peer review is the process by which practicing registered nurses systematically assess, monitors, and make judgments about the quality of nursing care provided by other peer members it is measured against the professional standards of practice. Reward is the ability to provide incentives. The nurse follows policies and procedures and protocols of healthcare agencies in which he or she is employed. Evidence-based practice requires that the nurse base nursing practice on best and most applicable in evidence from clinical research studies. Quality improvement processes improve the quality of care delivery to the patients and safety of healthcare agencies. Priority guidelines for patients use ABC. In CPR, it's changed to CAB. Use Maslow hierarchy of needs. Use ADPIE, assessments, diagnosis, planning, intervention, and evaluation. Assessments find and consider acuity level of patients. Assess loss of consciousness. In loss of consciousness, remember to check your patient's glucose level. In the event of a disaster, activate emergency response plan immediately. It's required by every hospital or medical facility. When you get into the hospital, when you're doing your in-service, you will be taught about disaster emergency response. Think survivability. If you are the first to respond to a scene of a disaster, such as a train crash, priority victims are the ones whose life can be saved. Example of safety: putting side rails up, washing your hands. These are safety concerns. Okay, this is all we have today on our leadership program. You'll receive more leadership once you get to MedSurg. Hope you enjoyed this little conference today. Just hit your like button, hit your subscribe and share, please. I will be back in my next video. Have a blessed day. Keep studying. Take care. Thank you.